Three brothers. The youngest, just 13 years old, got drunk, wandered into the street, and was killed by a truck. The middle brother grieved, got angry.
We need to guarantee preservation of our services and our jobs for those who provide those services to the fullest extent possible. So let me share with you the state of the agency going forward. What pays for the agency services? You can see from the pie chart that 41% of our funding is state and federal. So when the state has a crisis, we have a crisis. When the feds have a crisis, we have a crisis. We know that realignment and vehicle licensing fees pay for 16%, and our Mental Health Services Act is 3% of our budget, and that money is threatened as well. We have fees, Medi-Cal, Medicare, insurance fees, about 26% of the agency budget. 8% is grants, and that's in social services and public health, basically. And 6% of our funding is county funds. So the total agency budget is a little over $108 million. Of course, with the state today, we know that the projected deficit is over $49 billion, $14.8 billion today, and that affects all county services. We know that there are proposed reductions, suspension of COLAs for Medi-Cal, county administration and social services, cuts to CalWORKS, IHSS, and others. We have a projected over $500 million reduction in realignment, a projected $75 million drop in vehicle license fees. Additional cuts may show up, and what we've most recently learned over the last few days is the state is now proposing deferring health and social services payments through September 1st of '09. The county may not have the capacity to float these programs. Statewide, it's a $3.46 billion number that we're talking about. We may not have the capacity here to float these programs if we don't get our payments. Our budget crisis, when we talk about, what's the cause, when did we learn this, what happened, what have we been doing? Basically, on November 21st of 2008 is when the State Department of Finance reported a 5% projection in vehicle license fee and health realignment shortfall. And so if you look at that, and they base that on what we actually received in 2008, it was a little over $16 million. So the projections for '08-09 is a little over $15 million, which gives us an $800,000 deficit, which wouldn't be bad if there weren't 5 months left in the year, and the funding with federal mandates is a 50% match. So when we talk about $800,000, we're looking at doubling that for 5 months left in the year. So we're looking at a $1.6 million deficit. So basically, 52% of our shortfall is social services, which is why when we talk about options going forward, we're specifically talking about social services staff. Mental health is about 24%, and public health the same. So where does our revenue go, all the $108 million that we get into this county? Well, you can see 10% goes to contracts, 14% to operations. 76% of the money for the agency goes to salaries and benefits. We could turn the lights out from now until July 1st. It's not going to make that much of a difference to hit that $2 million figure. So in July of '08, we knew that we would be looking at a deficit this year with the state funding. We weren't sitting on our hands. We knew that we had something coming. We weren't sure of a number. We couldn't say we absolutely need to do X, Y, and Z because we didn't have a hard figure. We couldn't come to the board and say, you know, we absolutely have $1 million deficit. We need to do X, Y, and Z. But what we could do is take responsibility ourselves and begin to try to reduce our expenditures within the agency, which is what we did. We figured, well, maybe about $1 million deficit for '08-09. Of course, as you recall, we knew we had a balanced budget in September, but going forward, we wanted to be certain that if the state really did come down with a revenue shortfall, that we'd be able to respond to that. Go ahead. We shifted staff and programs. You'll hear more about that. We limited hiring to internal only. We restricted overtime, extra help, and travel. We increased our community collaboration, looking at areas, trying to eliminate duplication of effort between county services and community services. We implemented voluntary time off in November. We limited our purchases, and we eliminated building upgrades. Also, there's been a lot of focus on increasing revenue. How do we bring revenue into this county? And really, under the direction of this board, you formed the Health and Human Services Agency. Part of the goal in forming the agency was to leverage funding to bring in more dollars, essentially to increase revenue. We have done that here.